Please, can you introduce yourself and say why we're here today?
Right, I'm Jerry Boulder. I'm the head of health protection at the Public Health Agency, and I'm here to talk about issues around the new coronavirus.
Now, the Chief Medical Officer has indicated today that it's a matter of when, not if, we get cases of this virus in Northern Ireland. From your point of view, does that necessarily spell fatalities or a very serious spread among many people?
Hopefully not. I mean, whereas it is almost inevitable that we will get a case at some stage within Northern Ireland, we have to look at what's happening on a global basis. Most of the fatalities so far have been in China. There have been a few outside China, certainly, but the impression that we're getting in terms of the disease itself as it's spreading and as we're learning more about it is that for the vast majority of cases, it's a mild condition. But that's no cause for complacency, and we're still in a very early learning phase about the virus, which is why what we're doing at the moment is trying to ensure that when it does come into Northern Ireland, we identify it as quickly as possible and take the necessary steps to isolate the people who are identified as having it and ensure that, as far as possible, that it doesn't spread any further within Northern Ireland.
And if any Northern Irish people feel that they may have the virus, they have symptoms, they're concerned because of their travel, what should they do and what shouldn't they do?
Right. The first thing is that it will be a small group of people that will be potentially at risk. And there are two aspects to it. One is the travel, that if they have travelled from any of the mentioned countries, mainly mainland China, but a number of other countries will be identified within the past 14 days. The other thing is that they must have the symptoms. And these symptoms include fever, cough, shortness of breath. If both of those conditions, or if they feel that both of those conditions are satisfied, they should seek medical advice. Now, we're emphasizing that they shouldn't go directly to their GPs, for instance, or to hospital. They should phone up and seek out medical advice over the phone. If they meet the case definition, they will get further advice on what to do next.